afternoon and welcome to another episode of Health and Wellness. I'm Karima and today my guest is Dr. Meltzer, Clinical Associate Professor here at Jefferson Hospital. And today our topic is gout. Thank you for having us with you. So what exactly is gout?
Gout is a type of arthritis that occurs because there's an elevation in the blood of uric acid. And uric acid is usually dissolved in the blood, but it can come out of solution and can deposit in joints, and then there's a very intense inflammatory response with the arthritis, and that's what it is.
So what are some symptoms or what are some signs of gout?
So the symptoms are the arthritis,
right.
And the arthritis is, when it starts, is very acute in the onset, which means it's very quick in the onset. It's usually in the lower extremity, in the big toe or in the foot.
Okay.
And people can be asleep, feeling fine. In the middle of the night, they can just start having pain, and by the morning, they can't even have the sheet touching their foot.
Wow.
So the natural history is that even untreated, the attack of gout will resolve in a few days. But what happens is the attacks can start coming closer and closer together in time and can become increasingly difficult to treat. The other thing is that the uric acid can also deposit in the kidneys.
Okay.
And so you can get uric acid stones, or you can even get some chronic kidney disease.
Wow. So what are the treatment options here at Jefferson for gout?
Well, the first thing we do when we start about treatment is we discuss lifestyle,
right.
Because lifestyle is one of the biggest risk factors.
Right.
And then there's another part which is genetics. So it just runs in some families. So if you have genetics, we can't do anything about that.
Really?
But we know that beer increases the uric acid.
Okay.
Whiskey maybe a little bit, but wine not so much. And the other thing that people don't know so much about the diet is fructose. And
okay.
Fructose is a type of sugar which is in
a lot of sodas and a lot of juice.
You got it. That's it.
Wow.
So we tell people to really watch the
fructose levels.
The fructose in their diet. And then the other thing, there's a profile of the type of person who gets gout.
Okay.
So it's more common in men than in premenopausal women.
Wow.
But it's also more common in obese people and overweight. And we're starting to see elevated levels of uric acid even in teenagers now who are obese. So we tell them so part of our treatment is not medicine, but is lifestyle.
Wow.
So it's not to drink as much,
dietary.
To lose weight. We also see people who have something which is called Metabolic Syndrome have a
right.
higher incidence of gout. So these are people who have central obesity, so they're obese in the middle,
right.
and have high blood pressure, diabetes, hyperlipidemia,
wow.
and may have heart disease. So treating those diseases may help the gout. By the same token, if someone has gout, they may, we're not saying 100% sure, be at increased risk for cardiovascular disease.
Wow.
So it's very important for them to make the lifestyle changes, not just for the arthritis, but for their general state of well-being. One of the things you need to do to make the diagnosis of gout is you have to listen.
Yes.
And we really take pride in the fact that we listen to our patients, and there's a tremendous amount of mismanagement of gout, and that's because people don't understand how disabling the gout can be. And also what I just said is that untreated, the attacks can become closer and closer together in time, and you can destroy your joints.
Wow.
So we really try to make sure our patients are as smart as possible
about it.
Yeah.
That's wonderful. Okay, so you said about mismanagement with gout. Can you elaborate more on that too?
Very much so. So it starts off with just the diagnosis. So I gave you a description of the typical person waking up with a red hot toe, but sometimes people, one of the precipitating events might be trauma.
Right.
So someone bumps their foot or bumps their, their hand or something, and then they have gout, but people don't think about it.
Yeah.
So then they don't get treated
Right.
for it. The other mismanagement I see is the patients. We have drugs that will bring the uric acid down to normal, and some of them are extremely inexpensive, but the patient's feeling well. And so they say, I don't need to take
It's like, no, take it to the
right
to the
so
full
they,
process of it.
Right, so they stop taking their medicine, and guess what?
It comes back.
It comes back. So that's a big area. The other is in treatment. Some people who have mild kidney insufficiency, we have a medicine called allopurinol that lowers the uric acid, and it can be used in mild renal insufficiency.
Right.
And some people are just so worried about the kidneys, but they don't realize that if they don't control the uric acid, they may have more problems with their kidneys,
Right.
and the patients will suffer a lot. Those are probably the biggest mistakes. Yeah, oh, and I guess there's one more too, is we use anti-inflammatories, and if you have renal insufficiency, if your kidneys aren't working good, then the anti-inflammatories
Wow.
can cause pain. And then there's another drug we use called Colchicine, and we found out recently that if you can take 2 pills as soon as you feel like you have an attack of gout, and then 1 more, and it works. But some people just keep taking it, or they start taking it too late. And one of the side effects is really bad diarrhea. And the last thing you want is to have bad arthritis and have bad diarrhea at the same time. Yeah. So those are some of the big mistakes that we see.
Wow. Well, thank you so much. It's really enlightening.
Thank you.
If you have any other questions for Dr. Meltzer or just the department in general here at Jefferson, give us a call here at 1-800-JEFF-NOW.